Hello, I'm Dr. Jagdish Hiremath, practicing interventional cardiologist in Ruby Hall Clinic, Pune. I am the director of Cath Lab here. Today we are going to touch upon some basics about high blood pressure. Heart muscle, when it pumps blood into the aorta and it comes out in a form of a wave. So the top portion of the wave is called the systolic blood pressure and the lower portion of the wave is called the diastolic blood pressure. All the organs are designed to work at a blood pressure of 120 by 80 millimeters of mercury. A blood pressure which is higher than 140 by 90 millimeters of mercury is called hypertension. If it remains high for a long period of time, then the organs like the brain, the eyes, the heart and the kidneys can get affected, and that's called the target organ dysfunction. Acute drop of blood pressure, suppose the blood pressure drops to 100 or 90 suddenly, then it is a serious condition in which the person can feel dizzy. There is nothing like low blood pressure as a disease. Somebody can have a blood pressure of 110, 70 and completely can be normal. So it's like being shot, so it's not considered a disease. However, acute drop of blood pressure is a serious condition. Then there are terminologies of blood pressure like uncontrolled blood pressure. That means you are taking medicine or not taking medicine, but the blood pressure is very high, is uncontrolled. You are taking medicine yet it is uncontrolled, is called resistant hypertension. There is something called malignant hypertension where the blood pressure is very high and it can acutely affect the brain and the heart. Or there is something called accelerated hypertension. With or without treatment, the blood pressure should be below 140 by 90 millimeters of mercury. If somebody is above 60 years of age, then we may allow it to go up to 150 millimeters of mercury in the systolic range. In India, the prevalence of blood pressure is 33% of the adult population. That means any 3 people meet, one of them could be a hypertensive. Primary blood pressure means there's just no other cause, but it is just there. And secondary means it is secondary to causes like kidney and so many other factors. Of course, majority of the blood pressure that we see is primary blood pressure. One thing we must remember about the basics of blood pressure is high blood pressure doesn't mean heart disease. If blood pressure remains high for a long time, it will result into heart disease. That is about the basics of hypertension.